Hey guys, Natural RN here. Today I wanted to talk to you guys about OR nursing during a pandemic, so please keep watching. So as we all are very much aware at this point, there is a pandemic that we are all in the middle of currently with the COVID-19 or coronavirus, however you choose to call it. It's all the same thing. But it has definitely had a huge effect on everything going around as far as different businesses. Restaurants are closing. People are finding themselves here lately without a job, basically, because their business has closed for this pandemic. So people who have had jobs for years that they get up and go to every day have now all of a sudden found themselves in a position to where they are struggling financially, not able to provide for themselves or their families. And it's very, stressful. And I wanted to talk to you guys about this because, it affects a lot of people. Obviously, it's a pandemic, so it's worldwide. And as far as jobs go and nursing and healthcare and things like that, it definitely has affected that quite a bit. Being in the healthcare field, specifically nursing, you always have this sense of job security. You feel like, well, you're always going to have a job as a nurse because people are always going to be sick. There's always going to be a need for you. There's always a shortage of nurses, all the stuff that you've always heard, going through nursing school. And even if you get into your actual nursing career, you actually see these things for yourself. So it was a bit of a reality check for me as an OR nurse circulator to realize that that's not always the case, basically, because what happens is during this pandemic that's going on, a lot of surgeries have been canceled or pushed back, or, not really doing any surgeries that aren't emergent, or surgeries are being pushed really far back or just being canceled altogether in general. So for an OR nurse circulator who works in surgery, and that is your primary role, that leaves you kind of at either your hours have been cut significantly, or some nurse circulators have been laid off, actually. So, there aren't any surgeries happening unless they're urgent or, life-threatening surgeries. So when you don't have the surgeries coming in as an OR nurse circulator, what is your role? Where do you fit in? What is your job now? I know at my hospital, we stopped doing all elective surgeries, that includes anything like, plastic surgery or maybe a cataract surgery or anything that wasn't emergent or medically necessary at the time. So that cut back a lot of our hours. You definitely have the emergency surgeries that you still have to do, the life-threatening ones, any type of trauma surgeries, anything having to do with, hearts or pregnancy related, or anything that's life-threatening, any type of maybe surgery that will lead to some type of diagnosis as far as cancer goes. Those types of surgeries definitely still take place, so they still do those. The whole idea of cutting back surgeries from doing any type of elective surgeries to only doing emergent surgeries or medically necessary surgeries is to cut back on the exposure risk, because the more you're at the hospitals or the surgery centers or wherever you do your surgeries, the more you're exposed, to this virus, and the more likely it is to spread that virus to your patients or the staff that are helping you do the surgeries and take care of these patients. So it's definitely to cut down on the risk, and I definitely understand that. At my facility, our hours were significantly cut, and I was very worried, a little bit stressed out just because of the unknown, because, things were changing fast. No one kind of knew where they fit in as far as in my department with surgeries, because some people, that's all that they had ever done was surgeries. They had never, worked on the floor or done any other type of nursing or healthcare other than that. So it was kind of like basically trying to figure out, if this goes away, what can I do next? But fortunately enough at my job, our hours were cut, but we all still had positions. We all still had jobs. And also our facility, did the whole pandemic pay thing, which I was very grateful for. So that just kind of supplemented our hours that we basically they cut our hours in half. So maybe we would work like maybe 4 or 5 hours a day. So whatever hours that we didn't work, they would make up for it in pandemic pay up to 80% of our pay, which, a lot of us were very grateful for. Also, the facility that I work for is pretty big, so there were a lot of opportunities to work in other places in the hospital to get hours, screening patients, the patient, not just patients, but also anyone who comes into the hospital. You screen them, take their temperature, ask them if they have any of the signs and symptoms of the coronavirus. So that position is definitely ongoing. Also, with nurses and people who have previous experience in other areas of healthcare, also had a lot of opportunities. Like for me, my experience is coming from med surg, so I had opportunities to go and work on the floor and help out with patient care. Some people were CNAs or techs, and they also had those same opportunities to help. So I was very grateful for my facility for that, for being able to, where the hours were cut, they were able to kind of make up for that in certain areas. So at my facility, we currently have picked back up to full-time hours and are doing, more surgeries. Still not doing 100% of surgeries, but we're definitely doing more surgeries than we were, when we were going through the decrease in hours and things like that. So everyone's pretty much getting all of their hours. But COVID cases are on the rise again, guys. All over. Some places more than others. Where I am, we're not necessarily the epicenter of the COVID-19, but with things constantly changing, you could just look up one day and you're the new place, you're the new hotspot for the COVID-19. So the uncertainty of things right now can get pretty stressful and overwhelming. So for me, I know I just try to stay as flexible and as safe as possible. I definitely try to find stress relievers outside of work, as far as, working out, being creative, like maybe starting a YouTube channel, or definitely keeping in touch with my loved ones, my family and friends. That's been pretty much my rock through this, everything that's going on, keeping in touch with them, FaceTiming, when you can't visit them, it's like you can still see them. That's helpful. All of those things have been very helpful in keeping me sane and just, keeping me in my happy place, if you will. So, well, anyway, guys, that wraps up this video. I hope that it was helpful in some way, shape, or form to you. Nurses, I know I'm right here with you guys. Keep being awesome in whatever area of nursing that you're working in. It doesn't have to just be OR. You guys are on the floor, nursing homes, home health, anything that you got going on. You're definitely appreciated. Please comment down below, and if you're having any type of experiences related to mine or even some of your own, I would love to read about them. And please like this video and subscribe to this channel. Anyway, guys, thank you for watching, and I'll see you guys in the next video. Bye.